but also we're going to be talking about some of the politics of medicine and the business of medicine. And there's really nobody better in Manhattan, in the city, who understands these healthcare systems and also deals with some of the mergers and hospitals getting together and the patient care than my good friend and the CEO of Lenox Hill Hospital, Mr. Dennis Connors. Dennis, good morning. Dave Samadi here. How are you?
Good morning. I'm doing great. It's not snowing, Dave, so it's wonderful.
Well, thank you for giving us a few minutes of your time on Sunday. I know your schedule is always booked up, but I'm very honored to have you here. I've been in the hospital at Lenox Hill Hospital for about 2 years, and every day it's been fun and enjoying myself. We've been able to help a lot of patients, and it's a true honor and privilege to walk in that building. As a CEO of the hospital, I want you to tell us just, what's so special about Lenox Hill Hospital? How is it different than other hospitals in the city?
Well, I think many people don't realize the rich history of Lenox Hill. The hospital has been servicing the communities for over 150 years. It was originally founded by German immigrants that were migrating over to the United States. And what makes Lenox Hill pretty special is that a lot of first things have occurred at that hospital. The first intensive care unit in New York was built at Lenox Hill. The first cardiac care unit was built at Lenox Hill. And one of the first schools of nursing was started at Lenox Hill Hospital. Since then, obviously, it's become a very large tertiary care institution, meaning we have highly sophisticated services. And we service the entire metropolitan area, but also attract people from across the country and across the globe. We offer everything from basic primary care services to general health screenings to a very sophisticated level of medical and surgical specialties. And having David Langer there obviously tells one how special we really are.
Well,
we're also home of the New York Head and Neck Institute, which is one of the largest ear, nose, and throat groups in the metropolitan area. We do a lot of robotic surgery. As you know, David Samadi is one of the top robotic surgeons for urology, and we also do it for thoracic surgery. And during the past 2-3 years, U.S. News and World Report has ranked Lenox Hill Hospital as one of the top performing hospitals in cardiology and cardiac surgery.
That's really fantastic.
We're very proud of what we do.
Well, you should be proud of what you do every day. And I think what I realize, and I've been in a few hospitals, and there are a lot of great hospitals in New York City, but I think what I said early on, I truly believe in it. It's a big enough hospital that has all super subspecialty and also all the talents, technology in it. But that human touch and the fact that all the surgeons work like a family, and when you see a CEO of a hospital walk through the building and is in touch with reality and deals with the doctors and the patients, that's very special. And I always say that it's the only Park Avenue hospital in the world. I have more questions for you, but we have a hard commercial coming up. Wait for me. As we come back, I have more questions for you. We're with Dennis Connors, CEO of Lenox Hill Hospital. All right. So we are back with Mr. Dennis Connors, and who is the CEO of Lenox Hill Hospital and a good friend of mine. And we were talking about the Lenox Hill Hospital and what we have to offer. But one of the big questions that comes up all the time, Dennis, is all these mergers that are going on. And the one who really was a visionary and started this whole thing was nobody better than Michael Dowling, the CEO of North Shore LIJ. And now we have, I don't even know, every week it was 18, now it's 20, and I think by next week will be 22 hospitals, which is great. I mean, we're expanding in Westchester, Staten Island. Lenox Hill is obviously the Manhattan exposure to this system. What's going on? How is it affecting the patients? Should patients worried or not? Is it for better? Maybe you can shed some light on this.
Yeah, well, it's obviously something that's happening across the country. People are talking to each other. Everyone is courting each other. It's extremely difficult nowadays for a hospital to be totally independent and think that they're going to get through all the turbulent times that are ahead when it comes to medical reimbursement, et cetera. So people are out there partnering. It only makes sense due to the external and some of the internal pressures. And what it really is having an impact on is we look at duplication of services, and it's a benefit now to partner with someone and maybe, begin to combine services between institutions. And when you have 20 hospitals in the health system, it really kind of improves access to medical care. and it helps the hospitals operate more efficiently. There's a whole lot of economies of scale. For instance, the most obvious is group purchasing. When you go to purchase sophisticated technologies that are in the marketplace nowadays, when you're purchasing on behalf of 20 hospitals, you're going to obviously get a better price. And that means savings back to the consumer, savings back to the patients. So it's the wave of the future. It's currently going on. And, you know, being part of North Shore LIJ truly has its benefits. We do a lot of idea sharing, best practice sharing, which ultimately will improve the care that we're giving to the people that we're servicing.
Without a doubt, and I've seen it personally in how they can affect the hospital for better and how it can improve the quality of the care of the patients. Now, if you had to predict the future of medicine, whether it's in the city, certainly Lenox Hill Hospital, where do you think we're going to be 5 years from now? And how is the whole field is going to change? Where are we headed for a lot of people that are listening to this?
Well, I think where we're heading is to a lot of primary care, ambulatory, outpatient services, where we're going to continue to see a decrease in the number of hospitals, the number of beds in hospitals, and we're going to see a proliferation of urgent care centers, ambulatory surgery centers, physician practices that are going to be open in the evenings and weekends. Much more of a focus on outpatient services away from the traditional inpatient care. So something really to look forward to, so complete access to people within their own neighborhood so they don't have to travel very far as well. We're looking to open possibly 20 urgent care centers in Manhattan over the course of the next 5 years, giving people readily access to medical care when they need it 24 hours a day.
So that's interesting because I've seen in the last even few months in the city where you see these like small little, I don't know if they call them urgent cares or 1 minute health or whatever they are, where instead of going to the hospital, you can go in and get checked for simple things like flu, or is that where we're headed with this?
That's where we're heading it, because what we're trying to do is move patients away from the emergency departments that are located in hospitals to these outpatient settings, because people necessarily don't need to go to a hospital emergency department when they fall ill.
I see.
They should be directed to their primary care physician or their specialist. If that's not available, if it's not a true emergency, these urgent care centers truly have a place in the market.
Well, that's a really good point I think you're bringing up, because when you talk about, for example, nosocomial infections or infections that you can get from the hospital, avoiding going in sometimes, it's great, especially for simple things that you may not be there for a long time, and also takes a lot of traffic from the emergency room and opens up the door for a lot of people who absolutely need it. So I think that's quite interesting. Well, Dennis, it's been great. I know that on projects that we work together, certainly for robotic prostate surgery, which is what I do, the vision was to create a home within Lenox Hill Hospital. It's a beautiful floor that we have for patients with almost like no infection. The satisfaction rate or press gain is about 99%. And I know people come from all over the world to this hospital, which I always call it the only hospital, Park Avenue Hospital in the world, called Lenox Hill Hospital. I appreciate you bringing some history into this and also your certainly your expertise. It's great to see you every day at Lenox Hill, and thank you for being on our brand new show over here.
Oh, thank you, Dr. Samadi, and it's great working with you.